Jason runs a busy cafe in the city. Recently, he's been finding it really tough to concentrate at work, and things that he used to remember easily have been completely slipping his mind. He's gone to his GP, Dr. Jones, for a different issue. But Dr. Jones notices from Jason's body language and responses to questions that something else is going on. Jason doesn't feel ready to talk about what's going on for him right now, but Dr. Jones knows that Jason needs some additional support. She speaks to Jason about going to talk to someone and writes a referral to a mental health professional for him to use when he's ready. Then she shows him the Mind Health Connect website. Dr. Jones explains that on this site, Jason can find some great information about eMental health resources that really work. Dr. Jones also shows Jason how to search the Beacon website for evidence-based eMental health programs. She prints the list of programs that could help Jason learn to understand and manage the depressive symptoms he has been experiencing. Dr. Jones circles the name of an online treatment program that she feels will suit Jason best, so that when he gets home, he can look it up on the internet and work through it at his own pace. Working through an online program can be done without the pressure Jason fears he may experience if he has to talk about his symptoms with someone face to face. When Jason visits Dr. Jones for his follow-up appointment, they are able to discuss his eMental health experience and whether or not he is ready for the next step. Jason says he is finding the eMental health program and resources really interesting, beneficial, flexible and easy to use. He's been able to identify his symptoms as indicators of depression and now feels ready to explore what's going on for him further with face-to-face help. Jason thinks he'll keep working on the online treatment program while receiving face-to-face treatment for an additional level of support. He says he finds knowing that online support is on hand anytime he needs it, especially when he feels his mood is really low, very comforting. So whether your patient is a depressed 18-year-old who refuses to see a psychologist or psychiatrist, an anxious 30-year-old woman who wants to know more about her symptoms and condition before seeing a mental health professional, a 58-year-old man with an alcohol problem who has come to you for a referral face-to-face treatment, or a grieving 70-year-old widow who isn't sure if there is reason to speak to anyone about her problems, there is probably an online program that will help you help them manage their mental health. Regardless of whether they live in a major city, a regional town, or on a rural station miles from their neighbours, as long as they have access to the internet, there are treatment options just a click away.